The danger should be eliminated and make the area as safe as possible. If there isn't any danger, then it is safe to go up to the injured person and see what is occurring/happening. If there is danger, you need to remove it as soon as possible. You need to check for their response, asking them, are they alright? If they don't respond, then gently shake the shoulder. If they still don't respond, then presume they are unconscious and move on to the next stage. Someone who is unconscious should take the priority, so the person should be treated first and as quickly as possible. However, in this case, the person is not unconscious as they have only dislocated their wrist. Airway. Is the airway open and clear? You'll need to check this. If not, tilt the head and lift the chin to open the airway. You also need to check if they are breathing. Are they breathing normally? You will need to look, listen and feel to check they are breathing properly. You also need to check if there are any signs of severe bleeding. If yes, you will need to call the 999 as soon as possible. And also you will need to control the bleeding with your gloved fingers of type of clothing. If the dislocation is serious, you shall call the 999 and your doctor will manipulate, reposition the joint back into place. You will be given an anesthetic to remain comfortable and also to allow the muscles near your joint to relax, which eases the procedure. Also, once your joint has returned to its proper place, your doctor may ask you to wear a splint for several weeks. This will prevent the joint from moving and allow the area to fully heal. The length of time your joint needs to be immobilized will vary depending on the location of the injury and how severe it is. Most of your pain should go away once the joint is returned to its proper place. However, your doctor may prescribe a pain reliever or a muscle relaxer if you still feel in pain. Check the danger. Check that neither you nor the unconscious person are in any danger.
Headshot.
If necessary, make the area safe and then assess them. If you are alone, shout for help, then see if the person responds. Shout at the person, for example, "Can you hear me?" or "Open your eyes." Also gently shake the shoulder for response or pinch their fingers. If they respond, they are breathing, but check for severe bleeding and other injuries. You may need to help them to breathe by opening the airway. You do this by placing one hand on the forehead and using 2 fingers to lift their chin up. If they don't respond, you need to check if they are breathing. Position your cheek close to the mouth. Look, listen and feel for no more than 10 seconds. Look to see if the chest is rising and falling. Listen for breathing. Feel the breathing against your cheek. If they are breathing, put them in a recovery position until help arrives. Turn them on the side. Lift chin forwards in open airway position and adjust hand under the cheek as necessary. Check they cannot roll forwards and backwards. Monitor breathing continuously. At the hospital, they'll do a CAT scan to see if the brain is swollen. Check that neither you nor the person are in any danger. If necessary, make the area safe and move everyone away. Also check their response by asking them if they are alright and tell them to open your eyes. If they don't respond, then gently shake the shoulder. If they still don't respond, then presume they are unconscious. However, in this case, the person is still conscious and he floats into unconsciousness. This is because he has a broken leg and is in major shock. When the person has a broken leg, you should avoid moving the injured leg as much as possible, keeping it straight and put clothing underneath for support. Do not try to move any bones that are out of place. Cover any open. If the person is pale, cold, or sweaty due to the shock, lie them down and carefully rest the leg above the level of the heart to improve the blood flow. When raising the broken leg, ensure it keeps straight. Keep them warm and calm until you get medical help. Also check if the airway is open and clear. If not, tilt the head and lift the chin to open the airway. Later on, the initial treatment for a broken leg usually begins in an emergency room or urgent care clinic. Here, doctors typically evaluate your injury and immobilize your leg with a splint. If you have a displacement fracture, your doctor may need to manipulate the pieces back into the proper position before applying a splint. Restricting the moving of the broken bone in your leg is critical to proper healing. To do this, you may need a splint or a cast, and you may need to use crutches to keep weight of the affected leg for 6 to 8 weeks or longer. You will likely need rehabilitation exercises and physical therapy to reduce stiffness and restore movement in the injured leg. Because you haven't moved your leg for a while, you may have stiffness and weakened muscle having a strain is different and differently treated than any other ones that I've talked about previously. This time we're going to be using PRICE, which is protect, rest, ice, compress, elevate. However, you will still need to remove the danger that's surrounding the person who is injured and check if everything is alright and if they are conscious. Using PRICE, you need to protect by applying an elastic bandage, sling or splint. Remember to rest the muscle for at least a day. Use ice immediately and continue to ice for 10 to 15 minutes, an hour, for around 2 to 3 days. Remember to compress by gently wrapping with an elastic bandage, but you also need to remember to not wrap too tightly. Remember, you have to elevate the injured area, if possible, for at least 24 hours. Remember, avoiding harm. For the first 72 hours after a sprain or muscle strain, you should avoid harm. This means you should avoid heat, such as hot baths, saunas, and heat packs. Alcohol. Drinking alcohol will increase bleeding and swelling and slow healing. Running or any other form of exercise that could cause more damage. Massage, which may increase bleeding and swelling.